We're hearing for the first time from the active duty Navy doctors helping a major Indianapolis hospital.
They've been there for the past month as staff battle a record number of COVID-19 cases. News 8's Garrett Bergquist joins us now live from IU Methodist Hospital. He's given us an inside look at what those doctors are facing. Garrett.
These sailors tell me when they took their oaths, they never imagined they'd have to do a deployment right here on U.S. soil. The doctors here at IU Health Methodist say the presence of this Navy medical team has been a game changer.
I kind of counted on, a trip, overseas at some point. Didn't think that these were going to be in the pipeline.
Lieutenant Commander Donovan Mabe has been a Navy pulmonary and critical care doctor for a decade. He deployed to Afghanistan 3 years ago. The pandemic means his more recent deployments are a lot closer to home.
I went to Lafayette, Louisiana. Similar, it was a large hospital, but not quite the size of this hospital.
As COVID hospitalizations hit new records in December, Dr. Mark Luchtemeyer's team at IU Health Methodist was at the breaking point.
Utilizing every available bed that we could, including additional surge spaces. So we had continued to restrict our elective surgeries, look at other mitigating things that we could do.
What they really needed was more doctors. They turned to state and federal officials. On December 20th, U.S. Army North announced a 20-person Navy medical team would come in to help. Mabe has spent the past month with IU Health Methodist critical care team. He treats a variety of pulmonary issues, but most of the patients he's seen have had COVID.
We do our best to sort of get, very personal with the patients and get to know them. I've got to know some great people as patients, and then also, just meeting their families and talking with their families.
From a clinical perspective, individuals with skills that they have are hard to find.
Dr. Luchtemeier says the Navy team has been an enormous help, both practically and psychologically.
If you think about being asked to work an extra shift because we're short or because the demand is so high, and having that continually be one of our team members is exhausting. And even one shift that you don't have to go back in for is a huge improvement for our team members.
Mabe says he plans to leave the Navy in another year and a half. He says he'll remember this deployment for a long time.
It's been a very rewarding experience, and we bring our expertise, but we also learn a lot when we come to do these types of missions as well.
The doctors here at Methodist weren't the only ones who needed help. There's a lot of critical administrative work that goes into running a hospital during a pandemic as well. Coming up at 6, we'll hear from a sailor who's keeping things running smoothly. Live at IU Health Methodist Hospital, Garrett Bergquist, Wish TV, wishtv.com, and follow us on Facebook.
Thank you. A bit of good news in the fight against COVID-19. New numbers in Indiana out today show hospitalizations have dropped. 122 fewer Hoosiers are hospitalized with the virus compared to yesterday. The bad news, Indiana reported its highest number of new COVID-19 cases to date. Let's go ahead and bring in Wish TV medical expert and former Surgeon General Dr. Jerome Adams. Dr. Adams, let's quickly get into your reaction on that record high number of cases in Indiana. I mean, how important is that number, and is there any evidence that Omicron is peaking?
Well, we've seen some delinking of cases and hospitalizations because people are getting vaccinated and boosted in greater numbers, but we still haven't seen a complete delinking, which means these cases still are important because a certain percentage of them are still going to end up in hospitalizations. Good news that hospitalizations are going down. The key message here for folks is get your vaccination, get your booster, because as long as it takes to go up and hit a peak, it takes that long to come back down the mountain. So we're not out of the woods yet.
People are still talking about that booster shot. We have new information from the CDC today about the effectiveness of the booster shot against Delta and Omicron. And you've been pushing hard for a while now that the booster is critical to being considered fully vaccinated.
Exactly. New study came out from the CDC showing that with the Omicron variant, vaccines were 90% effective at preventing hospitalization, 82% effective at preventing emergency department and ER visits if you got 2 doses and a booster. With Delta, the vaccines were about 81% effective at keeping people out of hospitals. Within 6 months after second dose, With Omicron, that fell to 57% if you didn't have a booster. So again, incredibly important, regardless of the official definition, that people understand you're best protected if you've gotten that booster dose in addition to your 2 doses of vaccine.
So what about someone who may have gotten the first dose but never went back to get that second dose for whatever reason?
That's a very important question you asked, and particularly for minorities. We found that many of them have gotten 1 dose, but they didn't go back and get their second dose. So we're talking about boosters, and they aren't even at dose number 2. You can go in and get that second dose at any point. If you have questions, ask your doctor, but get that second dose and then go back and get that booster afterwards. 3 doses is ideal. 2 doses is better than 1. 1 dose is better than none. So wherever you are in that spectrum, go in and try to get to that 3-dose series so that you can be best protected.
Let's talk about masks for a second, because there's some folks that are kind of frustrated with the new guidance. Is it time for everyone to wear N95 masks, and do cloth masks help at all?
Well, it's important to remember that if you're going out in a snowstorm, you want to wear a thick winter coat. If you're going out in a light drizzle, then you can get away with a light raincoat. Cloth masks worked well for us throughout most of the last year because we were dealing with variants that weren't as contagious as Omicron. Omicron is so contagious that we need to use the best protection we can, and it's why I personally wear an N95 mask when I go out in public. That said, if you don't have one, or you don't have one that's comfortable for you, some mask is better than no mask at all. So wear the protection that you're comfortable with, and ideally an N95 mask for everyone is going to give you the best protection, but it doesn't mean that if you can't use that one, that you shouldn't use anything at all.
So quickly, if they don't have the N95 mask, should they wear the cloth mask with, another mask behind it? Is that a better practice if they have to use the cloth mask?
Exactly. One end of the spectrum, best protection, N95, better than nothing at all, a cloth mask. But you can double up. You can wear a cloth mask along with a surgical mask underneath. 2 layers is better than 1.
Thousands of people in Indiana rush to sign up for those at-home COVID test kits that are being mailed out. Those should start arriving in mailboxes pretty soon. What's the best way to use them?
Well, it's all about whether you want to protect yourself or protect others. If you have symptoms, that's a great time to use that test when you get it in to determine whether or not you're infectious, because it can help you decide whether or not you need to seek treatment and whether or not you need to isolate. If you're going around someone else who's vulnerable, you've got a grandmother or an aunt who you want to go visit, and you want to make sure you're not taking something dangerous into them, that's protecting others. That's another great time to use a rapid test and make sure, hey, I'm doing everything I can to protect my auntie, my grandma. So whether you're protecting yourself or protecting others, think about when is the best time to utilize that test, because remember, we only get 4 per household from the government.
Dr. Adams, I have another very important, of course, question. How are you doing after last night's game? I know you are dying to talk about the health effects of storming the court after IU beat Purdue. Mm-hmm.
Oh, my goodness. Well, I saw a few people out there wearing masks, and, I tell people, it's okay to go to these games. I was at a Purdue game last week, one that we actually won. And if you're vaccinated, if you're boosted, if you're wearing a mask, then you can make an intelligent decision about whether or not you go out there. IU fans, we're going to get you back when you come back to Purdue in a few months.
We'll check back with you then. Dr. Adams, thank you so much.
Thank you.
All right, well, keep in mind you can now order free at-home COVID-19 testing kits by the phone. The Biden administration launched its hotline today, that number on your screen. The website went online earlier this week. Remember, only 4 tests will be given per household, as the doctor just said. Tests are expected to ship in 7 to 12 days. COVID-19 has left many schools struggling to find substitute teachers. We found one school district that's now recruiting parents to help out. News 8's Camila Fernandez spoke with school leaders and a parent that's pitching in.
With Omicron hitting classroom staffing, Hamilton Southeastern Schools is in desperate need of substitute teachers.
There's always a need for substitute teachers, but now, especially during the pandemic, there's even a greater need.
The school district says it's seeking more than 50 substitute teachers.
The district's been really clear about the need, and so they've done a good job communicating.
Clint Wilson has a 3rd grader and a kindergartner at Geist Elementary School. Wilson is a State Farm agent, but he says he enjoys subbing every few weeks to help.
It's really just getting in and reading the plans the teacher has for the day. I found that teachers are incredibly prepared. I don't know how they do it with all of a sudden, hey, you're going to be out sick, but yet you still have to plan an entire day.
The school district says subs can make their own schedule. Ben Orr has a daughter in junior high.
They transfer from class to class, so they have several different teachers. She's seen a lot more absences there.
He says he's grateful that the schools have remained open despite these challenges. You must have 30 hours of credit from an accredited university or college to be a substitute teacher with Hamilton Southeastern Schools. Reporting in Fishers, Camila Fernandez, Wish TV, wishtv.com, and follow us on Facebook.